Well, epilepsy, as you know, is a very common neurological disorder. It affects all ages, from infants to elderly individuals. It has diverse causes. Some may have a genetic component, as it sounds like yours possibly may, with at least two affected family members. Oftentimes we have difficulty getting histories of seizures that go back very far, because in our grandfather's time, epilepsy was very much a hidden illness. People were often kept at home. They didn't go out. They were afraid of having a seizure publicly. And
Emily Dickinson was believed to have had epilepsy, according to some new research.
that I didn't know.
Okay.
I didn't know. But certainly there are many, many people, including such eminent historical figures as Julius Caesar. So epilepsy is a common disorder, so it's not surprising that both ordinary people as well as royalty and other famous individuals have it as well.
And I think what you were saying is that there's actually probably many causes.
There are. The term epilepsy really refers to a group of disorders, the common feature of which are recurrent seizures. And the seizures themselves vary enormously, from momentary lapses, where somebody may just be thought to be daydreaming initially, to the classical generalized convulsion that's been known since antiquity. So,
from the absence seizures to shake, rattle, and roll.
Yes.
Okay. What about the most intractable cases of epilepsy, which I think everybody would have the most interest in, the ones that cannot be well controlled?
well, first of all, there is now much greater use of epilepsy surgery. So seizures that are uncontrolled by medicine and that originate locally within an area of brain that can be surgically removed are now often benefited in ways that was not readily possible before. The requirement, of course, are twofold. One, that the area of the brain that is resected not be so vital that you leave the patient with a deficit that is as bad or worse than the seizure. So we don't operate directly on speech centers, for example, or motor areas of the brain. But there are many areas that we can operate on, and one of the common causes of epilepsy is temporal lobe epilepsy. And temporal lobe epilepsy is in many ways now a surgical disease. That is, many of those patients can really be cured of their epilepsy, and the rest may be benefited significantly.
Okay. And what types of surgery can be used? Classic cutting or radiosurgery? Or
The typical kind is pretty much traditional surgery in which a portion of the brain, the epileptic portion of the brain, is actually physically removed. It's not cut out like you chop something, but it's very carefully removed, and sometimes we need to actually map functions that are vital, that are near to the epileptic area, using electrical and other techniques, including occasionally having the patient wake up during surgery and test them, particularly if language might be involved.
Okay. And also, I was going to ask you about some of the